This morning, Tia Trudgeon is sitting down with healthcare broker Kevin Dorr of Mapping Medicare for a monthly Medicare help session. Tia, what are you all talking about this morning?
Elizabeth, we are talking about 3 important changes that happen to Medicare now that we're in the annual enrollment period. So if you are a Medicare recipient user, you'll want to stick around because this affects most people. So yes, I'm here with Kevin Dorr. Kevin, you tell me that there's 3 changes to really watch out for.
Yeah, there are a number of changes, a few more than 3, but the 3 big ones that are going to have an impact on pretty much every Medicare recipient are change in Medicare Part B, as in boy, a change in some of the prescription drugs, of the framework of that, as well as adult immunizations. And with Medicare Part B in 2023, this year, the Part B premium is $169.70. That's going to go up to $174.70 at the beginning of the year. The Medicare Part B, as in boy, deductible is $226 this year, and on January 1, that'll go up to $240.
So a price increase there, $5, $14.
Yep. On the prescription drug side, prescription drugs can have a maximum deductible that they can have. I should say drug plan. And in 2023, that's $505. In 2024, that moves up to $545. Now, that doesn't mean that every prescription drug plan has a $545 deductible. There are plenty of them out there that have a 0 deductible, and a lot of them that have less than the $545. That's just the maximum. And one thing, a change that's going to affect fewer people, but for the people it does impact, it's very important. There are 4 stages to the drug plans. There's the deductible that we just talked about, the initial stage, the coverage gap, and the catastrophic. And in the catastrophic, beginning in 2024, if someone gets into the catastrophic stage, there is 0 cost for the drugs. And the great thing is, in 2025, when someone gets into the coverage gap, those drugs will be 0 as well. And beginning 2025, the maximum anyone will pay for prescription drugs is $2,000. So that's a big change over the next 48 months.
So big changes so far with Medicare Part B, premiums and deductibles, and with the prescription drug plan, but also immunizations.
With the immunizations right now, I'm sure most people know that Medicare covers number of immunizations, pneumonia, hepatitis B, flu shots, and several others. They'll be covering diphtheria, tetanus, and shingles in 2024 with 0 deductible and 0 copay.
All righty, Kevin. Well, this is a lot of information, and it affects a lot of our population of viewers. So I wanted to say thank you for chatting with me about this morning. That's all the time we have for right now. But in about 30 minutes, we are going to continue this conversation, talking about the changes happening to Medicare and how it's going to affect you. So check back in with us in about a half hour, ladies.
All right, we will do just that. Thank you so much, Tia.